Good morning. Hello. We can't hear you, doctor.
Oh, it was muted. Good morning.
Yeah. So we are three people here just now. I think we'll get more people joining us soon. By the time I'll just read out the questions, which are some of them are repeated questions. I'll just at least read out to you guys. Yeah, so one of the patients has written that how much should we exercise on a hot weather as I have heat intolerance. So Claire was also saying just now, it's too much of humid and too much heat there. How is the weather in US, doctor? Is it bad there as well?
The weather?
Yeah?
The weather's fine.
Is it not
It's
that
about
heat?
about 75.
Oh,
That's hot for us here in the UK. We're not used to that heat. It's usually raining or murky and grey. So if we get anything in excess of 20 degrees, we're such snowflakes. I just melt. But I just slow down my pace when I walk. And I find that as long as, for me, I don't want to stop exercising. I just want to do it at my own pace.
yeah.
But still try. That's the only advice I could give to that person. And take a bottle of water. That's my only other piece of advice.
So, Dr. Zolo, as said, the question is also the same that during hot weather, how much a person should exercise when ideally the person exercises 30 minutes per day. Should they ideally reduce their amount of exercises or should they continue with the same?
It's really, depending on how they feel, everyone's going to respond differently. So if they can tolerate it, then continue. Some people might, the heat doesn't really affect absolutely everyone. So, it's really dependent on how they feel, but just keep yourself nice and cool. If you can, like we talked about, maybe the cooling vest or just even having a cold towel around the forehead can
Right.
help just regulate body temperatures.
Right. Okay. The other doctor that we have, the question that we have is okay, this lady has written that is spasm or muscle tightness due to MS. I'm getting bad spasm on my back and my right hand regularly since last 2-3 times in a period of 6 to 8 months. So it's a complaint that she comes up with in every 6 to 8 months, saying that she has spasm problems and probably she has to get some kind of injections for spasm for muscle relief relaxation. So she just wants to know, is it a part of MS or is it something else?
I mean, it could be, I believe like all these orthopedic things are secondary to MS because if you're getting nerve pain or numbness, then all your muscles are going to tighten up.
Right.
So if we could control the nerve pain, and if someone has MS and they're starting to walk less and sit more, everything's going to tighten up.
Right.
So I think it's like an indirect reason from the MS.
Right. Because even I have seen that, when I don't exercise much, I do get muscle cramps on my calf and I do get such kinds of spasm, like sitting long hours in the office and working on the laptop. That's what we do.
Right.
And so we get more prone to such things. Speaking of while I am, of course, asking the questions, if anybody else has any kind of questions, you can please type in here and or just ask questions, right? Okay. Okay, the other question that I have received is from Manvi. She has written, okay, it's a repeated question from last time, and she has written that I have numbness on my feet and hands and I need exercises for it. So what exercises should I refer to her, doctor, from the video that you have sent? The nerve exercises?
We can make, because we don't really have one yet made for specific numbness, but that could be one that we can do is talk about nerve tension
Yes.
ways to relax the muscular tension. So we can maybe make a video for that for Monday.
Right, because lots of people are actually coming up with numbness problem nowadays. I think, if
Yeah.
I see on a daily basis, I at least get one message talking about numbness from someone or the other. Okay, I can see a question here by Huawei first. And it's written that I have a question about how long I have to do exercises to improve my walking.
Yeah, so I would say like how long, so you want to start an exercise program, but you need to give it minimum 6 to 8 weeks because that's how long they say it takes for the muscles to develop. And I would recommend about 4 to 6 times a week. So trying to do at least 4 times a week would be beneficial. And from all of that, you really want to try to start off exercising gentle. You can start 15 minutes a day, 20 minutes a day, but really aim for minimum of 30 minutes per day. Minimum 30 minutes per day, minimum 4 times a week. So minimum about 2 hours a week. Of course, no maximum, like really just do as much as you can. But once you get through, the beginning stages, when it becomes a little bit easier to work out, then you can increase your tolerance and do more and more.
Yes.
But
So,
always give it like at least 6 weeks because it's muscles can deteriorate very quickly, but it takes a long time to regain that strength. I made a post like about a month ago with one of my patients with MS. We do computerized strength testing, so we actually see how much pounds of pressure you're exerting per muscle parts, and in 30 days she tripled her strength in a lot of areas.
um,
So you can some people, if you're exercising the right things, I was seeing my patient 3 times a week and giving her each time she was there about 90-minute workouts. So she was doing a lot of workouts, but you can see pretty significant gains if you do work hard, and it can happen quickly, but it could also take some time.
So if I say 30 minutes per day walking would be around 3,000 steps, 2 to 3,000 steps, depending
Well,
on the
not
day.
really the walking. I was referring more to like the strengthening program. The
Okay.
walking, I don't consider, the walking's like aerobics. That's more of like every day. I'm talking about 30 minutes straight of doing hip exercises, core exercises, things that are going to help ease the walking. Because if we don't do specific strengthening workouts, then we're gonna feel fatigued when we walk. But if we can get the quads, the calves, the ankles, and the glutes a lot stronger, then it's going to make walking itself easier.
Okay. All right. Okay. Thank you, doctor. Going ahead to the next question, David has written, "Hello, doctor. Yesterday, while walking, I felt a sudden sharp pain on the right side of my chest. The pain stayed there for a day and increased whenever I took a deep breath or moved my arm. What could be the reason?"
Yes, that's a good question. So the pain in the chest, it could be from a couple things. One, it could be from the pec muscle, which is through here, which
Mm,
if you were to kind of keep your arms up and do like lean forward to do a doorway stretch, that can stretch out the pecs. Or the one video we have over the ball for the MS hug, I would refer him to the MS hug video.
yes.
But the pain in the chest could also be from a nerve in the neck. But really, if it's during walking, I mean, I don't know if they're swinging the arms while they're walking, but I would refer the MS hug video, as that shows a lot of exercises to stretch out the pecs, stretch out the ribs, and that can definitely help with that.
Okay, but doctor, the person has written that he's got pain while breathing and all. Is it like a normal thing? Does
It
it
could be a rib.
Yeah, it could be a
Like
rib.
if you take a deep breath in and you get a pain in the chest, it could be a rib, or it could be the muscles between the ribs, which they call costochondritis, which doing those MS hug stretches will assist with that.
All right, thank you. Claire has written that her pins and needles come and go in her feet every time.
Yeah, so the sciatic nerve glide, I believe we showed it. I don't remember when, but we showed it. So I'll just repeat. But if you have your arms underneath your leg, and this is best in a laying down position, but if you just pump your foot up and down, and if you feel those pins and needles more, that means this is the cause of it. The sciatic nerve runs from the hip all the way down the leg. So if we have our arms and we just pump up and down you might feel increasing pins and needles in the beginning, but then if it starts to reduce, that means it's coming from that sciatic nerve. If it's coming from the foot itself, you could always try rolling your foot on like an ice cold bottle of water just to help reduce some of that tension. You're welcome.
Okay, Hovoy has asked that if swimming is a good exercise for MS.
Yeah, swimming I highly recommend for everyone. And you can, the reason why swimming is very beneficial for individuals with MS is because it allows us to really retrain the balance system with more confidence. So sometimes it could be difficult or scary to work balance on the floor because we might fall down. In the water, you don't need to know how to swim, but I recommend sideways walking and backwards walking quite a bit to do in the pool, as that can help with just building the overall strength. You can practice standing on one leg in the water. Overall, swimming will be good for the cardiovascular system. And then you could use like a lot of things in the water, such as dumbbells. They make steps where you can kind of step up and down. So yes, I recommend pool exercises and swimming.
Yeah, because like I said, when I had a attack, I did start with swimming. Otherwise, I never used to swim, and it really helped me to get my balance back and the strength back, and I actually became good. And especially during the summers, I think, because it cools down the body temperature, I think it would be a good exercise. Okay.
It also helps relax the muscles a little bit, and you can help doing stretching inside the pool will really help if anyone has like increased tone or a lot of spasticity. So
Okay.
I recommend.
Great. I have another question. Oh yeah, Claire has written that she also had sciatica pain in 2010. So that would be my question also, doctor. Like, I know my mom also recently had a sciatica attack, and she really suffered a lot. And does it remain a lifetime thing that you really have to take care of everything you are doing and not bend, not stretch your muscles during sciatica? Because even after 4 months of her diagnosis, I can still see, if she stretches her arm also, she starts getting that pain, and then she has to be on bed for like few days, 1 or 2 days. So is it a lifetime thing, sciatica pain?
So it really, if it's coming from the spine,
Yeah.
really something that we have to try to focus on every day. So I have a lot of patients who come in with spinal pain, and we really try to preach the core exercises to them to do regularly, because if the spine is unstable and weak, then the nerves are going to get pinched. So the more that we can stabilize the spine, similar to like doing those hip exercises, really keep, the hips and ankles are important for balance and walking, but the core exercises are important for keeping your back stable.
So if a person does a spine strengthening exercises, can that be able to avoid sciatica? Can that be a thing?
It can avoid it, and it can also help reduce the symptoms of it. So sciatica doesn't have to be a lifetime thing. If we can, and also a lot of times weight has a big contributing factor. If someone is very, very heavy and it's compressing their spine, and that can compress the nerves. A lot of my patients with back pain, if they lose 15 pounds, they feel significantly better already. So we have to make sure that our body's in a healthy weight as well, because the heavier we are, the more pressure we're going to put on our spine, hips, knees, ankles, all of that.
Okay. I have another question here from David again. He has written, there are days when I feel like yawning throughout the day. Could this be MS related to? Mm, is it something related to fatigue or something?
Yeah, I mean that's what it is it's an indirect. If someone is more fatigued from MS, that's going to contribute to the yawning. So really ways to control that is to help regulate the sleep cycle, and really make sure we are resting appropriately. Minimum of seven hours a night of sleep is what's, because a lot of times people might go to sleep at midnight, wake up at 5 a.m., or go to sleep at 10 p.m., wake up at 9 a.m. So we got to make sure we're trying to go to sleep and wake up the same time every day, and assure that we are getting adequate sleep throughout the night.
Yeah, because I can see during lockdown, especially, people have imbalanced sleep. They are not sleeping good. Um,
Yeah.
yes, doctor. Moving on to the other question that I received. Okay, someone has written about. I have recently been diagnosed with MS, and I learned that people with MS end up on wheelchair. Is it true? And that's
There's
even when I was diagnosed, I heard this. So I think that's a fear that everybody gets.
right. So we have a lot of patients. I treat a lot of patients with MS that don't use a cane at all and have fine balance, but I have patients with wheelchairs. So, the important thing is trying to get involved in an exercise program, because the people that stay active are the ones that keep themselves away from using canes. So really staying active, eating healthy will, keep you out of a wheelchair, because the individuals that stop doing everything and lose the ability to walk quickly from inactivity are the ones that require higher level assistive devices such as a wheelchair.
Okay, doctor. Um,
I can agree with that, because my sister has got MS, the same, and she's not like me. She pushed and pushed. Well, not pushed and pushed. She wasn't one for exercising or even getting out of the house, or she just gave up. And I'm opposite her. And now my sister's in a wheelchair, who can't feed herself or can't do anything, while I'm not going down that route. I just thought I'd pipe in while you were talking about it. That's all.
Yeah, 100%.
Thank you, Joe. Okay, so I have another question related to foot drop, and of course, I've shared the exercises that you recommended earlier. The other question is about when I wake up with a dizzy, why I wake up with a dizzy head in the morning, even after good night's sleep. Can you tell me what is it?
Can you just repeat that one more time?
I wake up with a dizzy head every morning, even after a good night's sleep. Can you please tell me what it is?
Dizziness.
Yes.
So a lot of the dizziness can come from the neck as well. The dizziness could come from off balance, but dizziness can also come from the vision. We know that MS affects the visual system, such as optic neuritis. The way I always like to try to treat dizziness is doing neck strengthening exercise in the beginning stages. But the dizziness can also be from inadequate nutrition. So if someone's not getting the proper vitamins and not proper adequate water, then they might feel in a state of dizziness. So if it's waking up and they get up quickly and then they feel dizzy, that definitely could be from the neck. And there's a lot of cervical exercises we can do, such as, having the resistance band and doing the retractions with the resistance band, or just holding your hand behind your head, retracting, holding for 6 seconds. You're going to feel tightening in the front of the muscle. Have your hand out to the side. Do side bending. So you're pretty much going like this, holding for 6 seconds. Here, Roko, 6 seconds, right? Hold it. So doing those kind of exercises in the 3 directions, about 15 to 20 reps, that can help with the dizziness if it's coming from the neck. Now, if it's coming from nutrition, I would definitely recommend for the individual to get blood work by their primary care physician. A lot of most of the time the blood work might look for specific things, and we could see if there's a vitamin deficiency that can be causing the dizziness. If all of that happens and the individual is still waking up dizzy, then I would maybe go see their eye doctor or ophthalmologist to see if maybe it might be a visual thing. But if the individual just gets up real quick in the morning and gets dizzy, it could be from the neck. It could also be a blood pressure indicator. Right. There's something called orthostatic tension, which is a really quick fluctuation of the blood pressure. And if that's not regulated, that'll cause dizziness from getting up from a low to a high surface, or from going from high to low surface. So those are really like the 4 main things I would try to address.
Right. Okay, thank you, doctor. The other question is more about the essential oils. I think we've spoken about this earlier also, but I'll still repeat the question. And the person has written, does essential oil help in pain relief? And how can we use it?
Yeah, I mean, there's a lot of, this is the question that I kind of left up to the group. I I forget it, which one. I think it might have, I don't remember which one, but someone spoke about their own personal use of essential oils. So I'd rather kind of leave that question open for the group, because there's so many different ones, but everyone's going to respond differently to them. It's like the similar to CBD oils. I know I personally mentioned, like, I recommend lavender for sleeping, but for particular pain relief, I'd maybe leave that open for the group so you guys can share what you found beneficial.
Right. Do you guys want to say something to this?
Iceland, I think her name is, mentioned it the last time, and somebody else, but they said certain oils, I can't remember what it was, but they give out a few different varieties of it, and they said that it helped them. I don't use them, but you know, it was good when they talked about it. I think it was 2 sessions or 3 sessions ago. But
Yeah.
yeah, I think Claire said it was Angie who discussed it. So I'm not the essential oils master, but that's why I like to leave it open for you guys to kind of share what you've used personally to kind of help with that.
Yeah, so Angie had recommended essential oils, and she was largely promoting, and she said that really helped her. And at the same time, Isa had spoken about CBD oils. She said that she takes CBD oils, but of course prescribed by a doctor. Then only she just doesn't go online and buy anything. Only if it's prescribed by a doctor. In fact, the other day when we had the interview with the neurologist, Dr. Mathews, even he said the same thing. CBD also has to be prescribed only by your neurologist or the CBD certified person. Then only you should use it, because that also doesn't help everybody, as everybody is not the same. But even I have used lavender oil, essential oils for sleeping, and I also feel that it really helps in some way. Other than that, even I have not tried any yet. Okay. Um, Guys, do you have any other question, guys, to ask the doctor just now? Okay, doctor, I do have other questions which is more related to headaches. So the person has said he's having headaches frequently, but is headache would be something to go to a neurologist, or physical therapy can also be a helpful thing in that?
So for me personally, I like seeing the patients. I like to try to fix them without medicine. A neurologist is going to treat the headaches by prescribing a medication, which I always try to fix everything naturally first. If 6 to 8 weeks of physical therapy don't help, then yes, I would definitely go check out a neurologist. But a lot of my patients, so one, sleeping position is very important. You never want to sleep on your stomach, because your neck is either up like this and you pinch everything here, or your neck is up like that and you pinch everything on the upper right side. What happens is, if the segments on the upper cervical spine or the upper neck are very tight, they're going to the nerves underneath the neck, and it's going to kind of shoot up and create tension headaches in the front. The way we fix is with proper sleeping on one pillow, laying on your back or your side. Also, when individuals are home, you want to really make sure you're not like this typing, because doing all that is going to put a lot of pressure on the neck. So you want to make sure you're nice and upright, and really going to a physical therapist that specializes, like, knows how to treat headaches, or even a chiropractor can help. If none of that really resolves it, I would recommend trying to see an acupuncturist, because acupuncture can help with the headaches. And if all those things don't really work, yes, then you can definitely, see someone who can assess those. But a lot of stretches, like the most common stretch that I give is for underneath the skull, having your hands on the top, bringing the chin down, and really just pulling your chin down to your chest. And you're going to feel that tension right underneath the head, holding for 20 seconds. That one's going to really help reduce a lot of the headaches.
And doctor, can I know one thing? So, for example, people with MS, they really complain a lot about migraines. That mostly people get migraines. Like, for example, in my case, I do not have much lesions on my brain area, but still I got migraine. It is also recent. I mean, a year back I started with migraine headaches, in spite of not having any kind of lesions. Is it that lesions affect the migraine thing, or it can just come randomly to anyone? I mean, is there can be any kind of reason defined for migraines?
Yeah, I mean, if the lesions are in the brain, to be honest, I'm not sure if that correlates with the migraines. I haven't had anybody really tell me that or ask me about that before. If it's, migraines usually are accompanied with like visual disturbances as well. So it definitely could be related, but someone getting a diagnosis with MS also is going to have a lot of stress levels, and higher stress levels will increase headaches, which can lead to migraines. But migraines are also linked to what people are eating. So if someone is having a lot of caffeine or a lot of chocolate or a lot of wine or cheeses or citrus foods, those 6 things are highly correlated to headaches and migraines. So I'm not sure if the lesions are, maybe when you are on one of your calls with your neurologist, that's a good question, because I'm not really sure if those 2 things correlate.
Okay, because I have seen like many people do complain of migraine nowadays when it comes to MS people specifically, and I all
Yeah.
had actually read that sooner or later migraines do come up in MS, and just eventually did in my case. However, my neurologist did give me medicines for migraine, but I've never taken it. I just want to stay away from them. Um,
A
well,
couple of years ago, I was diagnosed with cluster migraines. I went blind in the one eye and I was rushed into hospital, and they treated me. They gave me all like CT scans and they couldn't work out what it was. And then they found out it was cluster migraines, one of the worst migraines you can get. They treated me and my sight come back, but they never done an MRI. And my neurologist seems to state that if they'd done an MRI, they would have found lesions on my brain and I would have been diagnosed with the MS a lot sooner, because they have that as a link to my MS. I just thought I'd tell you, just think, but that's what they said. The same as where I had Bell's palsy, and they've linked that with the MS. But since I've been on Plegridy, my migraines are a quarter of what they used to be. So I do think that they are attached to the MS. And I do have them, I used to have them, would be when my cycle was coming to the end. So, yeah. So it's, I think it's all interlinked. I really do. Yeah,
okay.
that's just my point
Yeah,
on it.
because of course people without MS also have migraines for that matter. Yeah. Dr. B, I can see there's one question from David, and he's written just one more question, doctor. How to deal with tinnitus, randomly ringing in the ears that makes me crazy?
Ringing in the ears.
Yes.
So ringing in the ears, a lot of it could be from this muscle. That's, if you see, if I turn my head to the left, you see this muscle kind of come up, and it
Yeah.
goes over the ear. So if we try to massage this muscle a little bit,
Okay.
because it goes right up to the earlobes, but I would have them see either a chiropractor or acupuncturist, or they could try like self massage to that, because ringing in the ears could be correlated from the neck. If it's, if a chiropractor or acupuncturist can't assist with that, then I would have them see a ears, nose, throat doctor.
Okay. Thank you, doctor. I think this. Okay, doctor. These were the questions which I had from my post. Do you guys have any other question to ask the doctor today? I think we're done, doctor. So guys, we've already spoken to doctor also, since everybody suggested that every week, taking down is getting a little difficult because of the lockdown lift up. So we will, and also we need to have more questions to make it more interesting, instead of having few questions and repeated questions every week. So probably we will make the sessions a little lesser, maybe twice a month or something. So we will work out a schedule, doctor and me together, and probably we can you know, uh, pass it all to you. Also, doctor had referred about a neurologist last time. Probably we can, have one session with him also, if whatever is convenient.
All righty.
All right. Thank you, doctor. Thank you guys for
Thank
coming.
you soon.
Thank you. See
Right, bye, thank you.
Bye.
you. Bye. Okay, guys.